I'm Dr. Chris Landon. We were approached about 4 years ago on a very basic question by the First Five. The objective of the First Five is really to get children ready for school. Regardless of their financial abilities of their parents, we need to have children who are school ready. So today, this is yet another conference. We really need to tie this all together. Our speakers today, Dr. Kundell. Dr. Kundell is a developmental pediatrician from Thousand Oaks. I think he gave one of the first funded lectures by the First Five, really introducing, and I think he'll recap a little bit today, what a very poor job we do. That when we take the Denver developmental screening test, we draw a line through the 18-month and go a little bit on either side. That just does a terrible job. It's a non-validated test. It's what we call GOBSAT or GOGSAT, which would be good old boys and good old girls sitting around a table and just coming up with what their experiences are. So what we've done is really introduce PEDS so that we take a respectful view that the parents have an idea really of how their children are developing, that when they go to the park, that when they go to the store, when they go to the market, that they're looking at all the children, they're looking at their cousins. And if they feel in their hearts that there's something different, they need to have permission to talk to you. So the PEDS, the P-E-D-S, we'll talk about briefly. We've used that as a screening tool. We've taught that to our family practice residents. We've taught that to our pediatricians. It's used in a number of our clinics as a secondary tool, and for us a primary tool because we take care of such developmentally at-risk families who are socially have difficulties, putting their children at risk, teen mothers putting their children at risk, infants of substance abusing mothers who become children of substance abusing mothers, children at risk. We use a second tool. And we have been cooperating with a project from Johns Hopkins, and we have an online tool. We see that electronic healthcare record is an important wave of the future. The hardest part, though, is that last inch. And so with help with funding from First Five, we have tried very hard to work out, and Dr. Lapellis is going to talk a little bit, how do you introduce this into your clinic? And what they did that was so brilliant is they sat down the receptionist. This is where it starts. It doesn't start with the doctor. The doctor is the least important, no disrespect to ourselves. So the who is really important. The janitor should really want your child, their children, all the children in their neighborhood. If they work at your clinic, they are the medical experts for the neighborhood, and they should be excited about developmental screening. Dr. Laura Mabey has joined us as well. She's our current president of California Chapter 2, and we'll talk a little bit about the EDSI project. I spend a lot of time as the director of pediatrics with people pulling on my beard and going, "Ooh, I'm going to do this better than you," and thank goodness they feel that enthusiasm. And so Dr. Bobrau attended the EDSI from our Los Islas clinic. Dr. Copa and Dr. DeAndrea have joined them. And this is really taking a look at how can we improve the quality of care in our clinics. And they've done an excellent job, and we hope to incorporate even more of that into our program here in Ventura County. Dr. Goldie, our pediatric neurologist, we truly, in this county and really for 3 counties, are the center of excellence. We provide access to a pediatric neurologist for people with Medi-Cal, insurance, regardless of their ability to pay, but also we have the Tri-Counties Regional Center. And with the Regional Center, this is not the final, oh my gosh, now I have to reach down into, this is the finest care, the finest screening that's available. We have very energized caseworkers who are providing access to care, support to parents who may be mixteco, who may not have English or Spanish as a native language, and providing access to care throughout the county. As we surveyed our pediatricians and went to our family medical group practice, what we found is that the family medical group practice had, in the year 2009, had done 1 developmental screening. Now this is a group that's training 39 family medicine residents, and they had done 1 developmental screening because they weren't being paid. Thank goodness now through Medi-Cal and CHDP, you can be paid a reasonable amount of money. We are looking at a revolution, I guess, unless you guys have all written in by Monday or called, left your fax and messaged in, that all the children on healthy families will be moved to Medi-Cal. Here in this county, we have Medi-Cal managed care. What's going to happen in terms of payment for developmental screening? Are they still going to default to CHDP and allow us to have increased payment for this very important subject? Dr. Russell, who's one of our pediatricians and director of our maternal child health and adolescent program for the county, in other counties this has been the reward. They've taken the profits and said, you know what, if we start out right, if we start with developmental screening, this is how our children are going to have a future. And I need a future. All those 5 to 9-year-olds, as you see, are leaving us in Ventura County, and someone's going to have to care for me. So I really hope that we can provide them with proper development. Dr. Golub is going to speak a little bit to the collaboration between the community physicians and the Tri-Counties Regional Center, and I'm hoping that Verna Bushin will help to be a resource for him and his office in terms of really getting paid for doing developmental screening. Some insurances don't pay for it. We need to know how to bill for it properly. And then Dr. Elmansdorp, who we watched obtain her PhD, used our family medicine residents to help pilot a program looking at how can we screen for autism younger and younger. What we know through Tri-Counties Regional Center is that the younger that we intervene with autism, the better children do. The change in reimbursement meant that if you are screening and you don't have 50% disability in an area in motor, communication, you're not going to get paid for after the age of 2. We have to push the screening younger. And so what we've been able to follow is by doing this screening, we've been able to push communication referrals down to 15 months so that these patients now have access to a source of funding, have an early access to the proper intervention. So when I came here 22 years ago, I was just a young, crazy guy with a vision, and so I hope that hasn't changed a whole lot.